So we're looking at the patient's abdomen. We assess first the contour. So like I said, you have to look at it eye level. Okay, so the abdomen is a little rounded. Can you see? Okay, so there is, if you compare it to, from the ribs, there's a slight, bulging. Okay, and so we say that is rounded. Okay, now for the symmetry, so we said our landmark will be the umbilicus, so it looks like it's in the midline, but to really compare, you need to stand at the head of the bed, okay? Observing, you'll be able to observe already the pulsations. So you'll see the rise and fall of the abdominal wall, synchronous to breathing, okay? Now, can you please raise your head off the bed? Okay, good. All right, so you will see the tensing of the abdominal wall, the abdominal muscles, okay, down. There are no masses. You'll see the skin over the abdomen is pinkish undertones. There's no, dark or faint dark blue discoloration. Okay. Now we also now assess for stool. Let's say your patient has a stool that is, that they turned in. So what would be our normal finding for color of the stool?
Brown.
Okay, so you may have like dark brown. Okay. And what is the consistency? Semi-formed to formed. Okay. Now, if the color of the stool is blackish, iron,
Or occult blood.
okay, or you may have blood. When, what they call this, when it's blackish in color, and it's because of bleeding from the upper GI, what is the term that we use? What is the medical term that we use? Terry, that's a description, but what is the medical term to refer to black tarry stools? Tarry means it's a little like, sticky. Okay. Melena, that's right. Melena. Okay, now if, for example, we have a stool that is really bloody. Okay.
Lower GI.
Okay, lower GI, yes. But what is the medical term for that?
It could be hemorrhoids. From hemorrhoids?
No, yes, that might be a cause.
A
Yes,
cause.
the most common cause will be from a hemorrhoid. But what is the medical term for bright red blood in the stool?
I'm trying to remember.
Cherry.
Frank blood.
Frank blood, that's a description, but what is the medical term?
With an H?
Lower GI.
Yes, starts with an H.
Right. On the tip of my tongue.
No. Hematochezia.
Hematoma.
So hema. Okay, it's blood. Chezia, Chezia. Hematochezia. Okay, now if, like I said, the most common cause will be hemorrhoids. Okay, now if you, are looking at the stool and, you're not seeing any blood, but on further testing there is trace or hidden, so you have occult blood. Now, if the color of the stool is like this, how would you describe it?
Clay.
Okay, clay colored, and the most common cause of clay colored stool is?
Some deficiency.
I'm sorry?
No, for
Liver. A problem with the liver. Okay, you have, no, that's different.
Is it?
That's different. This is clay colored stool. When you have like a liver problem, and so the bilirubin is not broken down, so there is nothing to give color to the stool. Okay, now steatorrhea is when you have fatty stools. So stools may be more yellowish in color. They're heavy, that means they float, and you will see fat globules on the toilet bowl. Yeah, okay. Now, so those are the observations with the stool. Now, what about emesis? Okay, if the patient is
Throwing up.
bright red blood, what is the term?
Hyperemesis.
Hematemesis.
Hematemesis.
Hematemesis. Okay, you've forgotten the, how to combine words.
I said hemoemesis.
Because you have emesis, that's a vowel, so you drop now the O, so hematemesis. Okay, close, very close. Now, if you have what they call this, the coffee grounds material. Okay. Okay. Which part of the GI is where is that where? What part of the GI will be bleeding?
Upper.
Upper. Okay. Now, why is it not bright red blood?
It's old.
It's oxidized already.
It's oxidized by. It's old. That's right.
By the acid?
Yes, that's right, by the hydrochloric acid. So the bleeding occurred like a day, 2 days before, and so it's been acted on by the hydrochloric acid, and so what you're seeing now will be this coffee grounds material. Now, if the bleeding was just a couple of minutes ago, an hour ago, you will still be able to see hematemesis. Okay. Now, so these are some findings with regards to stool and emesis. So there is no stool sample that is submitted, no vomiting noted. Okay. So when you do the exam, you just need to tell me no, there's no stool sample, no vomiting. Okay. So you move on to the next one. So we now auscultate, and we said when we auscultate, we need to do an abdominal mapping. So it's just like dividing the abdomen into 4 quadrants. So you have the imaginary line, vertical line crossing from the xiphoid through the umbilicus, and then a horizontal line along the umbilicus. Okay, so right upper, left lower, right lower. Okay, so we listen. Do we use the bell or the diaphragm? Diaphragm. Okay. So 2. Okay. 6. Okay, so there's like 26. You'll hear more of the vowel sounds here. Okay, so unless, like I said, there is hypoactive or absent vowel sounds, you can listen to a quadrant up for about 15 seconds. Okay, now we do our vascular sounds. Okay, so we have the aorta here,
And you're listening with the bell?
and then on the upper quadrants, what?
Renal.
Renal. Okay. Then on the lower quadrants,
Cardiac.
okay, so no bruits are heard, and then around the umbilicus you have the venous hum. Okay, so we now go into percussion. So when we percuss, we need to be very systematic. So this will be your imaginary line. So we start from here, just above the imaginary line. 1. Towards the midline, that's 2. Just below the costal margin, 3. Towards the epigastric, 4. Across, 5. You hear the difference in the tones? 6, 7, 8, 9, 10, 11, Okay, so you will be able to elicit tympany, dullness. Okay, now we do our liver span. So we said there will be two landmarks for our liver span, the right midclavicular line and the midsternal line. So what we'll do here will be,
That's it.
yes, hold on, but I need also